Hello, my name is Kelsie Peterson, and I will be talking about the meaningful use of the electronic medical record systems. I currently work for the University of Tennessee Medical Center in Knoxville, Tennessee. A little bit about our 5 standards is that we are always supposed to smile and greet our patients and families with a smile. We need to be present a professional image, both personally and our physical environment. We partner with our patients and our families in the planning and delivery of their care. We respect their privacy and confidentiality of those we serve, and we respond to concerns and complaints. So improving quality, safety, efficiency, and reducing health disparities. Currently, we do a lot of our series of checks and balances to assure the safety of our patients in all respects of their care. The medical center has a designated patient safety officer who provides training. They also oversee us, the staff, to make sure that implementation of policies is done correctly. We are also able and given the opportunity to truly voice our concerns. If I see something in the environment that I feel is unsafe or is not going to be good for my patients or their families, I can say something to my upper management with no issues. Also, we have partnered, or we follow the Joint Commission. They set a standards in regards to patient safety that we follow. Let's see. The quality in healthcare is generally described as collecting and analyzing clinical data over a period of time. We measure that quality data and enables us to visualize the area where we are providing the best care for our patients and identify areas where we can improve. Our focus in providing our patients with quality healthcare is to make sure that they're safe, a secure environment free of medical areas during their stay, effective healthcare provided based on a scientific knowledge and best practice, patient-centered. So we truly accompany that and consider the patient's cultural traditions, personal preferences and ideals, and as well as family conditions and lifestyles. We love to work on our time, especially in the ER, decreasing waits and sometimes harmful delays for those receiving and providing health care, and efficient, avoiding waste, maximizing resource utilization, including waste of equipment, supplies, ideas, and energy. So an example of that we use is our SI reporting system. And what this does is it allows us to monitor our mistakes or monitor areas that we need to improve on. It gives us the ability to view where errors are being made and how to correct them accordingly. And when we learn and see these errors occurring multiple times, it allows us to say, hey, here's our issue. We need to fix this, and it allows the ability for a new policy or procedure to be implemented. And when that's done, and it's done house-wide, it gives us the opportunity to see if that's going to fix the issue that we're experiencing. And it also gives us the ability to provide safer and better care for our patients. So engaging patients and families in their health. This is also part of our 5 standards of care. Let's see, what we really truly encourage our patients to do is to speak up. It's sponsored by the Joint Commission, and it urges our patients to take an active role in their care. And by doing so, it gives us the opportunity to prevent healthcare errors. Having the patient ask questions, take a family member or friend to you with your appointments is what we suggest. Pen and paper always to ask questions, to write all your medications down and have them with you. Especially if you're in the ER, we can see what you're currently taking, so we don't, misdiagnose you or gives you something that will contraindicate something that you've already taken. And we also ask people to write in a journal between checkups and appointments. Improving care coordination, we really focus on our core measures at the University of Tennessee Medical Center. We record all our data publicly, and we monitor our surgical care and involved in the Surgical Care Improvement Project. We monitor and measure inpatient medical conditions such as acute myocardial infarction or heart attack, heart failure, pneumonia, outpatient conditions like chest and surgical procedures. Within these categories, there are more than 25 core components, such as antibiotic administration, influenza, vaccinations, smoking, quitting smoking, and it's also reported online as well. And this allows us, when we're doing this care, it allows us to A, see what our population's being admitted for, and B, what treatment plan is working best overall for our population and community. And by recording all this in our medical records, it gives us the opportunity to see the big picture, and it gives us also the opportunity to set up a treatment plan that will be most effective. Granted, every person is different. Every person needs a specific or unique treatment plan, per se. But if they can follow a certain idea of a treatment plan that works best for them, we will see better results throughout. Let's see. So for an example of better options of helping our patients and talking to them, consecutively through a group, we have an option called Perfect Serve and our patient advocate. Our patient advocate allows for a whole health care team to effectively communicate together and with the patient. Now, also what we have is Perfect Serve. It is a medical record that allows us to communicate. It's almost like a chat record, and it allows us to communicate with the physicians more effectively, and it gives them the ability to show concern. It gives us the ability to show concern for our patient status or patient concerns. And it allows them we can see when they actually see it or read it, and it gives us the ability to provide them the best care. So we improve the population and public health. So some ways that we do this at UT is among the most significant ways we support the community are through our health fairs. We partner with our other East Tennessee not-for-profit organizations. Health screenings for the uninsured. We provide breast health and cancer outreach programs. We support the Knoxville Area Project Access, providing education to patients and community members, regional training for EMS, and continuing education. In 2012, the University of Tennessee's Medical Center's financial contribution to community benefit totaled about $45 million. This includes the philanthropic resources, traditional charity care for the uninsured and those with limited means, and the unreimbursed cost of caring for patients. Medical research, education of health professionals, and hundreds of community service programs and medical centers in the local and in local schools and community centers. So some key organizational dashboard is something that we have on our main program site. And what this dashboard is so beneficial for us because it allows us to see visual graphs that depict where we are with our goals for the current term. It allows for healthcare tracking that can be beneficial for the care of our community, showing weak areas in care and how to decrease the amount of readmissions. So we're going to ensure adequate privacy and security protection for personnel health information. Currently, how do we use our medical information? When you visit UT, the only time they may use your medical information is to treat you to obtain payment for services and conduct normal business known as healthcare operations. Some examples are treatment. They record each visit and or admission. And this includes the test results, diagnoses, medication, and responses to medications or other therapies. Payment, they document the services and supplies. So when we have a patient on the floor, we keep up with all the supplies that we take into their room. We have a big container, we call it an Omni cell. And what we do is we log in with our user ID and password, and then we find them by their room number. And with that room number, we select it, and then we select the supplies needed to perform whatever patient care services they need at the time, whether that be IV fluids, bandage change, or anything like that. We are able to specifically document who's getting what so it gets billed appropriately. Also, healthcare operations, the medical information is used to improve the services we provide to train staff, students, business management, quality improvement, and our customer service. Some examples I've added on here to ensure privacy through secured computers, we have to badge in and out. We also have a secondary user ID and password that we use. We have a wonderful, wonderful IT staff that continuously monitors for attacks on our server and deals with them accordingly. And then also at each nursing station, we have shred boxes to remove any type of PPI, or personal identifiable information, PII. And there's a list of my references. And I hope you have a wonderful day. Thank you.